And along those lines, do you know anything about how it might interact with other drugs? We've heard about these 44 deaths that the FDA claimed, and then we see that in most cases there was fentanyl involved, and in some cases there were other drugs involved.
Yeah, some of the cases that were reported as Kratom related deaths, I mean, there were so many issues identified, and the other drugs that the people were using is certainly a big issue. Many of the cases, the people had severe depression, and there was one case, it was actually a suicide, but it was after the young man had used a Kratom product, and it was listed as a Kratom-related death, even though the guy had attempted suicide several times earlier. And, there was one case that I've heard of, but I haven't seen the report, where the guy was shot while under the influence of Kratom, and he didn't survive. Yeah. And it was listed as a Kratom-related death. That kind of stuff, as a scientist, I find that kind of hard to deal with. We need to look at these cases from a cleaner forensic standpoint. Do we have actual toxicology data on what the levels of mitragynine in the victim's tissues or blood was? Do we know what product the person was using? If we know what product the person was using, we could check and see if it was contaminated with other substances, because there have been reports of Kratom products being adulterated. Then another thing that's missing in a lot of the overdose reports is what other drugs was the patient taking? And do they have blood levels or tissue levels on the other drugs? What kind of doses were they using? And the fact that there are so few studies on Kratom in humans, almost nothing is known about drug interactions with Kratom in people. We just don't know. Those studies haven't been done.